All right, so I have a patient for you.
Okay.
This is, chief complaint is urinary frequency. She's complaining for about a month. So I saw 29-year-old Nikki Mitchell. She has no significant past medical history. She's coming in, like I said, complaining of urinary frequency for a month. For the last couple of days, she says she feels like she's been voiding every 15 to 20 minutes. But she does feel like she's completely emptying. She just gets this urge to go again. She denies no dysuria, hematuria, there's no vaginal discharge. She's also not complaining of polydipsia. I did kind of delve into her daily life here, and it seems like she eats fast food all day, every day. She has very little exercise, and she let me know that she has a very strong history of diabetes, and she's concerned about that for herself. So she states that her mom, her sister, and her grandfather are all being treated currently for diabetes.
Okay.
Of note, in May of last year, she did have a hemoglobin A1C drawn. It was 5.5.
Okay.
But she has had a bit of weight gain, and like I said, she admits that she does nothing but eat fast food, and she doesn't really do any exercise.
Okay.
She denies any chest pain, shortness of breath, no abdominal discomfort, and no changes in her bowel habits.
Okay.
Last but not least, she also complained of some low back pain for the last 3 months, but she states that she started a job at the post office at that time, and she does a lot of lifting and bending, and that pain is very consistent with her job.
Okay.
So that's kind of just a secondary follow-up.
All right.
As far as her kind of past medical history is concerned, only medication she's taking is her birth control orthotricycline. She does use lidocaine patches, PRN, for the back pain, which she said has been helping. No allergies. As far as her family history, it was just significant for the diabetes, which is what we focused on today. And she had no other review of systems that were complaints today.
Okay.
Exam was pretty normal, vitals are good, she's afebrile, blood pressure looks really good, actually 126 over 74.
Great.
All right. So, I'm thinking and wanted to do a lot of her history, just kind of figure out where I'm going with this. I'm thinking UTI, based off of a couple of things, but also my mind is going in the direction of diabetes.
Okay.
As far as UTI is concerned, she does have complaints of urinary symptoms, so she has this urinary frequency, kind of this urge to go. She isn't complaining of dysuria, and I also got a UA done today, just a quick dip. It showed that there was leukocyte, moderate leukocytes, but it was nitrite negative, as well as WBCs where it said few WBCs and no RBCs noted.
All right.
Okay. As far as the diabetes is concerned, she has a strong family history. She has this urinary frequency and a sedentary lifestyle. So fast food, she has had some weight gain, and I forgot to mention her BMI is 39, which is a little up from last year.
Okay.
It's important that she did have a normal or a low hemoglobin A1C a year ago, but that's still something very high up on my differential.
Great. Okay.
There's one thing that I'm not very clear on, and I'm sure I can do some more reading, but I was just wondering about a UA that has, it's leukocyte positive, because it said moderate leukes, but negative, nitrite negative, and few WBCs. So in your experience, like, can you still consider that a UTI, or is that something that you look at with the nitrite negative?
Yeah, that's a good question specifically about nitrite negative UTIs. I'll actually have to do some reading with you on that. But just in my experience, you can diagnose patients with symptoms alone, even without a UA. So I would, based on what you're describing, I would, consider treating that dip that you see there. But I'll kind of do some more reading about specifically nitrite negative urinary tract infections, see how common they are, their prevalence, and see if there's any difference in treatment.
Okay. As far as my plan at this point for her management, we did do the UA. I would like to send it for a urine culture just to make sure, if this is a UTI and what we're treating, that we're treating it properly.
Okay.
But I still feel that diabetes is high up on my list and something I would love to rule out.
Okay.
So I want to make sure to draw another hemoglobin A1C today, but also, counsel her kind of on lifestyle change, and at that point, based off of what the lab showed, then I can treat her if necessary, but still work with her for lifestyle changes because it is something that she's at high risk for.
Perfect. Right.
And because I had to ask you that question about UTIs, I really feel it's something that I can look into more and just really read up on the significance of the nitrite, part of your analysis, and what that nitrite negative versus nitrite positive, and then leukocytes, how you treat based off of the UA.
Great. Perfect. All right. Great. Thank you.
And end.